The year is 1942. Deep in the frozen wastelands of northern China, men in military uniforms drag a group of prisoners into a wooden barrack. The prisoners are shivering, their bodies thin and frail from starvation. A Japanese doctor enters, his white coat spotless despite the filth around him. He orders the men to strip. Then, with chilling calmness, he instructs his assistants to pour buckets of icy water over the prisoners' bare arms. The room falls silent, save for the dripping of water on the wooden floor. Moments later, the limbs begin to freeze, solid. The experiment has begun. The doctor wants to study frostbite, not to save lives, but to find ways to help his soldiers endure the brutal winters of war. This was Unit 731, the infamous biological warfare program of Imperial Japan. Here, humans were used like lab rats, tortured under the guise of science. And this is just one chapter in a much darker story of how science and cruelty have often collided in history. But how far have humans gone in the name of experimentation? And what happens when curiosity crosses into barbarity? What you're about to hear are not horror movie plots, but real events that took place under the banners of progress and discovery. Some of these experiments left behind groundbreaking knowledge. Most left behind scars on humanity that can never heal. The history of human experimentation is older than modern science itself. From ancient physicians testing surgical methods on slaves, to secret government projects in the 20th century, the pursuit of knowledge has often demanded a disturbing price. Today, we'll explore 3 of the most notorious cases, each a grim reminder of what happens when ethics vanish and ambition reigns. Let's begin with the Japanese Unit 731. Unit 731, Japan's Chamber of Horrors, hidden in Harbin. Manchuria, Unit 731, operated under the command of General Shiro Ishii. The official purpose, to develop biological and chemical weapons. The real activities were far more disturbing. Thousands of men, women, and even children were imprisoned here, labeled as logs rather than human beings. They were subjected to vivisection, often without anesthesia. Organs were removed while victims were still alive. Plagues were deliberately introduced into villages just to observe how quickly they would spread. And frostbite wasn't the only test. Prisoners were exposed to extreme temperatures, bomb blasts, and even surgery while conscious. One grim account describes victims being tied to stakes, bombed with anthrax or cholera, their suffering carefully recorded by military doctors. By the end of World War II, an estimated 200,000 people had died from Unit 731's operations and field experiments. Now here's the cruelest twist. After the war, many of Unit 731's doctors were never punished. Instead, the United States granted them immunity in exchange for their research data. The results of their horrific studies were seen as too valuable to destroy. It is one of the darkest bargains in history, the Nazi experiments. Science in the shadow of Auschwitz, meanwhile, in Europe, the Nazis were carrying out their own nightmarish experiments. At Auschwitz, Dachau, and Ravensbrück, doctors such as Joseph Mengele pushed the boundaries of cruelty under the pretense of medical science. Mengele, known as the Angel of Death, was fascinated with twins. He plucked children from the arrival lines, separating them from their families. They became his living specimens. He injected dyes into their eyes to try to change their color. He sewed them together to create artificial conjoined twins. Many died from infections, and those who survived were often executed so their bodies could be dissected. At Dachau, prisoners were forced into ice baths or exposed to freezing air in an attempt to study hypothermia. Some were locked in low-pressure chambers to simulate high-altitude conditions, often suffocating to death. Others were deliberately infected with diseases like malaria, typhus, or tuberculosis. The goal, officials claimed, was to help German soldiers survive extreme conditions of war. The irony is tragic. Very little useful medical knowledge came out of these experiments. Most of the so-called research was crude, unscientific, and sadistic. What it left behind was a legacy of trauma and the reminder that cruelty often disguises itself as progress. The Tuskegee study, a betrayal of trust. Fast forward to America, the land that prosecuted Nazi doctors at the Nuremberg trials. You might think such horrors could never happen in a democratic nation, but the Tuskegee syphilis study proves otherwise. From 1932 to 1972, the U.S. Public Health Service ran an experiment in Alabama following the progression of syphilis in African American men. The participants were poor, many of them sharecroppers. told only that they were being treated for bad blood. In reality, they were deliberately left untreated, even after penicillin was discovered as a cure in the 1940s. Imagine being told you're receiving medical care while the doctors actually want to watch you suffer. Wives became infected, children were born with congenital syphilis, and over 100 men died, all because the researchers wanted to see what would happen if the disease ran its course. The study continued for 40 years, even after its unethical nature became obvious. It was only exposed after a whistleblower leaked it to the press in 1972. The scandal shocked the nation and led to sweeping changes in medical ethics, including the requirement of informed consent, but the damage was already done. Trust between the African American community and the medical establishment was deeply scarred, a wound that still lingers today. Other shadows in science, and these are just the most infamous examples. The Cold War brought about Project MK-Ultra, where the CIA secretly dosed citizens with LSD to study mind control. In the 1950s, radioactive materials were injected into hospital patients without their knowledge. In the Soviet Union, psychiatric wards became prisons for dissidents, where experimental drugs were tested under the guise of treatment. It seems, whenever power meets secrecy, the human body becomes a laboratory. The dark humor of history. Looking back, one almost wants to laugh in disbelief, though the laughter catches in the throat. The Nazis claimed they were helping their soldiers. Unit 731 claimed they were defending their empire. The Americans claimed they were gathering data for science. It's as if every villain in history had the same excuse. We did it for your own good. That's the equivalent of a mad scientist saying, "Don't worry, this will only hurt a lot." Sometimes the absurdity is overwhelming. Imagine walking into a hospital and the doctor says, "Good news, we're not going to cure you. We're going to study you instead." That's not science, that's a horror show wearing a lab coat. The most evil experiments in history teach us a chilling lesson. Science without ethics is not progress, it is destruction. Human curiosity is a powerful force, but when it ignores morality, it becomes a weapon. These stories remind us that knowledge is never neutral. It matters how we get it and at what cost. Today, medical research is guided by ethical codes, oversight boards, and international agreements. But even now, controversies continue. From gene editing to artificial intelligence, the line between discovery and abuse is thin. The question we must always ask is, just because we can, does it mean we should? History's darkest experiments are warnings carved in blood. They tell us that the pursuit of knowledge must never come at the expense of our humanity. If you found this video eye-opening, don't forget to like, subscribe, and hit the bell icon so you never miss our next deep dive. Thank you for watching, and see you on the next one.